Hi, my name is Darby. I'm going to explain how to obtain an electrocardiogram. The goal of the electrocardiogram is to obtain a graphic representation of the electrical activity of a patient's heart. So the first thing that you want to do is make sure you have all the materials, the patient's chart, the electrocardiograph, the ECG paper, electrodes, the wires, patient gown, the drape, blanket, pillows, alcohol, moist towel, and scissors for trimming hair if necessary. So the first thing you want to do is to turn on the electrocardiograph and make sure that there's paper, an adequate supply of paper in the machine, and that the machine is up to date. And then identifying yourself to the patient and explaining the procedure and washing your hands. And the next thing to do is prepare the patient and ask them to remove any jewelry, socks, any clothing basically from the waist up. And also, depending on your provider, sometimes the electrodes are placed on the legs, so they might have to roll up their pant legs. The next thing is to assist the patient onto the table and put them in the supine position, lying flat on the back. If the patient is uncomfortable lying flat on the back, they can do the Fowler's position, which is putting positioning their head under a pillow and putting a pillow under their knees for comfort. And also telling the patient to lay quietly and lay still, because if they move or breathe abnormally for whatever reason, it could give an inaccurate reading. Next thing you want to do is prepare the patient's skin and wipe down their skin using gauze pads moistened with alcohol to clean the skin. And then so the electrodes will attach properly. If the patient has chest hair or anything like that, you might need to trim it just so the electrodes will stick better to the chest, or the legs if it's a male patient. And then the next thing to do is to apply the electrodes. And you want to make sure that the little tabs are facing down, because this was where the wires are going to attach onto here. So the V1 electrode goes is the fourth intercostal space to the right of the sternum. So that will be over here to the right. And then V2 will be the fourth intercostal space to the left of the sternum, which would be over here. And then I'll tilt this down so you can see. V4 is the fifth intercostal space on the left mid-clavicular line, which would be should be down here. Actually, no, it would be over here. One second. Yes, it would be over here. Okay, and the next one would be V3, which is the fifth intercostal space midway between V2 and V4, which would be over here. And then V6 is the fifth intercostal space on the left mid-axillary line, which would be over here under the armpit. If I can get it there. Down here. And then V5 is the 5th intercostal space midway between V4 and V6, which would be placed over here. Okay. And then you also want to place the electrode on the left arm. And it says to place it on the fatty part of the arm. And then one onto the right arm here. And then depending on your provider, which way they like it, you can place it on the abdomen right above the hip here and here. So you have a total of 10 electrodes. And then after you place the electrodes, you're going to attach the wires to each one. And then make sure that the patient is lying quietly, and then run the ECG. And then checking the tracings for artifacts, correct any problems that there might be. And then documenting the patient's name, the date, and my initials if they don't print out with the tracing. Then disconnect the wires from the electrodes and remove the electrodes from the patient. So I will remove these. And then after that, allowing the patient to rest for a moment and then assist the patient getting up. And that's obtaining an electrocardiogram.